Phase 0 is the time when you're doing that upfront discovery and early concept generation work, and it's the time when you're trying to decide what is the path that you want to go down. It's also the time when your solution, of course, carries the greatest risk. And so what we want to do in Phase 0 is, of course, make sure, are we going down the right path? But we also want to de-risk and validate all of those assumptions that you have so that when it comes time to investing in the downstream design and development or partnership activities, you can do so with confidence. My name is Amanda Spencer, and I lead our research and strategy team in the UK for Veranex. I started back at our Minneapolis design studio. And now my team of researchers works actually quite a bit with large pharmaceutical companies that are working through digital transformation efforts. And they're trying to identify what are some other ways that we could be meeting patient and clinician needs in ways that often go beyond, their traditional product portfolio. If you think about the Venn diagram of what enables a successful innovation, you have desirability, so are we actually solving an important need? Feasibility, is it possible to meet that need? And viability, can we extract value by solving that need for the business? I would say historically, my team has really focused on that desirability angle, which of course is critically important. We have to understand what are those needs that we're going after. But now we are really end to end, so thinking all the way from those early insights, early concepts through to commercialization. What that enables, and what I'm quite excited about, is that we can ask these really important questions much earlier on in an integrated fashion. So for example, we work with our colleagues in commercial strategy to begin to quantify, well, what is that business opportunity if we go out and try to meet that customer need? Or is there actual market viability in meeting that needs? Integrating these teams early on helps us to deliver those quite robust recommendations of which opportunities and which solutions we should be pursuing, and of course the evidence as to why. So our team of global researchers come from incredibly diverse backgrounds. And really what I would say unites each one of them is this pursuit for uncovering the why behind what people say on the surface and the reasons why they behave in the way that they do, the reasons why they take the actions that they do. So given Veranex is 100% focused on healthcare, our team of researchers are also really comfortable working in the complexities of that environment. They're also quite comfortable and good at spotting those unspoken opportunities in the clinical setting that maybe even the physician wouldn't be able to identify. For those types of challenges, we take this human-centered approach or human-centered design, and we try to uncover, first of all, what are those problems that we should be solving? And second of all, how do we go about solving those problems in the right way? And oftentimes that process can begin to reveal customer needs that the client hasn't even thought about today. And so we help to facilitate that. We help them to embed this human-centered design process into their organization and help them to really tell the story internally of why these new opportunities are worth pursuing. One challenge we worked on had us reimagining the next generation offering of this drug delivery device. Our client wanted to figure out, okay, how can we differentiate ourselves by meeting a new need that's not being met today? So we started this program with simulations of that drug delivery process with nurses, and then we actually observed them in the hospital setting. So I was there shadowing the nurses room to room in that hospital, and in that process we identified so many pain points that are causing them to be slowed down or even creating risk for the patient. So then we took all of those pain points and workarounds and put them onto this really visual workflow map. And that helped us to narrow in on what are some of the highest priority unmet needs that we should be going after. This process helped us to surface opportunities both around the redesign of that drug delivery device, so what would a next generation product look like? At Veranex, we provide the answers to really important questions early on in that innovation cycle. But I would say it's not just about what we do as a company, it's also how we work with our clients. So as much as we can, we truly try to embed ourselves into their teams, and this allows us to, in the end, become an extension of their team. And so all of those little things helps us to work together in a quite collaborative and seamless way.